Ensuring your baby's peaceful sleep is crucial for their development. Yet, it's equally vital to recognize potential hazards lurking in their tranquil slumber. Our aim isn't to instill fear, but to empower you with knowledge, allowing you to cherish every moment with your little one without anxiety. Understanding sleep risks, protecting your baby's slumber. Delving into the preventable dangers that could disrupt your baby's sleep. 1. SIDS, sudden infant death syndrome. This heartbreaking condition affecting infants in their first year strikes without warning. Research shows around 5 babies per week in the UK fall victim to SIDS, with 85% of cases occurring within the initial 6 months, and boys at a higher risk than girls. Prevention steps. Sleep position, back is best. Ensuring your baby sleeps on their back significantly reduces the risk of sudden infant death syndrome, SIDS. This simple yet crucial practice helps maintain an open airway, minimizing the chance of suffocation during sleep. Always place your baby on their back for naps and nighttime sleep. Avoiding tummy sleeping is imperative, as it elevates the risk of SIDS by a significant margin. Prioritize prenatal care for a safer sleep environment. Prenatal care plays a pivotal role in reducing SIDS risks. Expectant parents should prioritize a healthy lifestyle during pregnancy. Avoiding smoking, both actively and passively, is paramount. A smoke-free environment significantly lowers the likelihood of SIDS. Embracing a nutritious diet rich in essential nutrients supports fetal development and reduces potential risks associated with SIDS. Additionally, refraining from strenuous activities during pregnancy helps maintain a healthy environment for the developing baby, contributing to a safer sleep outcome. By adhering to these preventative measures, parents can actively contribute to creating a safer sleep environment for their baby. 2. Preventing blanket suffocation for safer sleep. Understanding the risks in cooler climates. In colder weather, the risk of accidental suffocation due to blankets becomes heightened. It's crucial to be vigilant and take proactive measures to ensure your baby's sleep environment remains safe and secure. Clearing the crib, creating a safe sleep space. To mitigate the risk of suffocation. Toy and clutter-free zone. Keep the crib clear of any toys or loose items. These can pose suffocation hazards, especially during the night when visibility is limited. Opt for a minimalistic approach to the crib's contents, focusing solely on essentials. No loose clothing. Avoid dressing your baby in clothing with loose strings or ties that could potentially wrap around their neck. This reduces the risk of accidental entanglement during sleep. Selecting appropriate bedding. The choice of bedding plays a crucial role in ensuring a safe sleeping environment. Fitted sheet on a firm mattress. Use a fitted sheet specifically designed for your baby's mattress. This prevents any chance of entanglement or the sheet coming loose during sleep, reducing suffocation risks. Avoiding heavy blankets or comforters. Opt for lightweight and breathable blankets or sleep sacks designed for babies. Heavy blankets or comforters can inadvertently cover your baby's face, leading to suffocation hazards. Alternatively, consider swaddling techniques that securely wrap your baby without the risk of loose fabric. By implementing these preventative measures, parents can create a secure sleep space for their baby, particularly in colder climates. Prioritizing a clutter-free and appropriately bedded crib significantly reduces the risk of blanket suffocation, ensuring a safer sleep environment for your little one. 3. Navigating co-sleeping risks for safer sleep. Understanding co-sleeping risks. Co-sleeping, while comforting for both parents and babies, poses potential hazards. It's vital to be aware of these risks to ensure your baby's safety during sleep. Room sharing as an alternative. Consider room sharing as a safer alternative to bed sharing. Crib in your room. Place your baby's crib or bassinet in your room near your bed. This allows for close proximity while maintaining a safe sleep space for your baby. It promotes bonding while reducing the risk of accidental smothering or covering that can occur during bed sharing. Utilizing co-sleepers for a safe compromise. For families who prefer co-sleeping, certain precautions can make it safer. Invest in a reliable co-sleeper. Choose a co-sleeper that attaches securely to your bed, creating a separate sleep surface for your baby. Look for one with a safety barrier or guardrail to prevent accidental rolling or movement that could lead to covering or smothering. Safe co-sleeping practices. If opting for co-sleeping, avoid soft bedding. Ensure the sleep surface is free from heavy blankets, pillows, or soft bedding that could accidentally cover your baby's face during sleep. Avoid alcohol or medication. If you or your partner have consumed alcohol or medications that could induce deep sleep or impair awareness, avoid co-sleeping to prevent accidental hazards. Constant vigilance and awareness. Remain vigilant and aware of your baby's position and movements throughout the night, especially during co-sleeping arrangements. Immediate adjustments or interventions can mitigate potential risks and ensure a safer sleep environment for your baby. By considering these preventative measures and alternatives, parents can navigate the potential hazards associated with co-sleeping. Whether choosing room sharing or using a reliable co-sleeper, prioritizing safety creates a secure sleep environment for your baby while maintaining the comfort of close proximity. 4. Ensuring safe feeding to prevent choking incidents. Understanding choking risks during feeding. Choking incidents during feeding can be concerning for parents. It's crucial to take proactive steps to mitigate these risks and ensure your baby's safety. Nipple selection for safe feeding. Choosing the right nipples and bottles is essential to prevent choking incidents. Age-appropriate nipples. Use nipples specifically designed for your baby's age and developmental stage. These nipples are crafted to release milk at a pace that matches your baby's sucking abilities, reducing the risk of choking. Bottle selection. Opt for bottles with appropriate flow rates that complement the nipple design, ensuring a controlled and safe milk flow for your baby. Supervised feeding practices. Implement supervised feeding practices to minimize the risk of choking incidents. Never leave unattended. Avoid leaving your baby unattended while they're feeding, whether breastfed or bottle-fed. Ensure that someone is present to monitor the feeding process. Complete feeding and burping. Ensure your baby finishes their feeding session before removing the bottle or ending breastfeeding. Additionally, burp your baby after feeding to release any trapped air, reducing discomfort and lowering the risk of choking. Safe feeding environment. Create a safe and conducive environment for feeding. Upright position. Hold your baby in an upright position while feeding to facilitate proper swallowing and reduce the likelihood of milk flowing too quickly. Comfortable setting. Feed your baby in a quiet, comfortable setting, minimizing distractions that could cause erratic movements and increase the risk of choking. Regular check on feeding equipment. Regularly inspect and maintain feeding equipment, ensuring they're in good condition and free from damages or wear that could potentially pose choking hazards. By adhering to these feeding guidelines and safety measures, parents can significantly reduce the risk of choking incidents during feeding. Careful nipple and bottle selection, coupled with supervised feeding practices, creates a safer feeding environment for your baby, ensuring each feeding session is a secure and comfortable experience. Your baby's safety during sleep is paramount. These preventive measures empower you to create a secure sleeping environment, ensuring your little one's peaceful slumber while effectively safeguarding against avoidable risks.